Welcome back. Mama Dr. Jones, ObGyn, and Mom24. Today we're going through the second part of Real Family's YouTube channel docuseries on strange pregnancies. Don't make that harder on somebody. It's not correct. Why don't you just adopt? That one word annoyed me. The last one of these we did was super interesting. She had a pregnancy that was attached to her bowel. This one, I don't know what it's about, but let's jump into the second part of Real Family's docuseries on strange pregnancies.
I had severe fibroids, which caused hemorrhaging, severe bleeding, severe enough that they had to do an emergency hysterectomy. I had previously been married and had 2 children, and I loved everything about being a mom, and to be faced with the fact that I couldn't carry any more children myself ever. It was pretty final, and it was devastating.
Unfortunately, she had gone through an experience of having what sounds like very significant bleeding that was life-threatening to her, and that she had undergone a hysterectomy because of that. She says that the reason that she was having such heavy bleeding is that she had fibroids. Fibroids are muscle growths inside the uterus. They are extremely common. It is relatively uncommon that they cause this, where it's such significant bleeding that somebody needs to have a hysterectomy emergently. But it is a common cause for hysterectomy in someone who is having really heavy periods that isn't responding to other methods of controlling them.
The couple turns their sights to adoption, but several promising attempts fall through.
We had a nursery set up, crib, bought clothes, all ready for the baby to come home, and it didn't happen, no baby.
I didn't want to talk about it.
I think this brings up a really great point. One of the really common things I hear my infertility patients say is that people will say to them, why don't you just adopt? The problem is that it's not that easy. Adoption is, 1, very expensive, and 2, very unreliable. Some people will go through the adoption process many times before they actually get to bring a baby home, and that can be extremely emotionally devastating to people. Adoption is a really excellent option for some people, and it's a really impossible option for others, and that's something you should just never say to someone who is going through infertility. If they want to talk about adoption, they'll bring it up with you, but you should never suggest to them that that's just an easy replacement, because it comes with its own set of really difficult trials to overcome, just like infertility in general does.
Kim's 55-year-old mother, Jackie, offers them a surprising new chance at surrogacy.
I did not know if it was possible, but I went to Kim one day and I said, I'll carry your kids if I can.
Honestly, I didn't even know it was possible.
Jackie's last pregnancy was 32 years ago. Jackie is 55 and has already been through menopause.
The lining of the uterus is responsive mainly to estrogen, which helps it to grow and thicken and become a happy home for an embryo to live. And when you go through menopause, your estrogen levels plummet and they're a lot lower. So her lining of her uterus is presumably going to be very thin. They probably will need to put her on estrogen in order to help thicken the lining of the uterus. There are some other things that I'm hoping that they cover. An increased risk of all kinds of complications that come along with pregnancy, such as elevated blood pressures, preeclampsia, blood clots, gestational diabetes. Pretty much any pregnancy complication that you can think of becomes more and more common the older someone is when they get pregnant.
2 of Kim's eggs are extracted and fertilized with Joe's sperm.
We transfer the embryos on the 5th day into Jackie's uterus.
But 2 weeks later, they face bitter disappointment. Jackie's pregnancy test comes back negative. 6 weeks after their first attempt, they give it their last best shot. 2 more embryos are implanted in Jackie's uterus.
So this is just semantics, but they aren't implanted. The embryos are taken from a petri dish where they have been growing, and they are transferred with a small straw-like thing into the uterus where they just are allowed to sit there. They aren't implanted. They're just moved. And if they would like to implant, they have to do that on their own.
It didn't work. We just didn't know what we were going to do next.
We have a philanthropic organization that is set up just for this type of situation where couples have gone through in vitro fertilization cycles, have not gotten pregnant, and then can't afford another cycle. So that program offered them a free cycle.
With 2 failed attempts, we just felt that, we'll transfer 3. Hopefully we'll get 1 healthy baby. I answered the phone and she's like, "We're pregnant." And I'm like, no way. It was the absolute best feeling I've ever had in my whole life.
So that is obviously super exciting. Like you can tell I don't know how long ago this was for her, but she's tearing up just talking about it now. But it's still so surreal, right? Like so unusual to have your egg, your husband's sperm, your mother's uterus, like she's carrying her own grandchildren in her uterus. And that is crazy. So now we've transferred 3 embryos, and the decision on how many embryos to transfer is a difficult one. The tendency right now is to transfer a single embryo. They call it elective single embryo transfer. And that is because of the decreased risk of multiples. But once you've had several failed cycles, especially in a situation like this that's a little bit unique, deciding how many to transfer, 1 or 2 or 3, depends on patient preference, physician recommendations, and then also the grade of the embryos. So how healthy they looked, how likely they look to be an embryo which will go ahead and implant and become a pregnancy.
Clinic officials believe Jackie may be the oldest surrogate in the United States.
Obviously, in the millions of pregnancies that are around the country, this was unique.
But the excitement is far from over. When Jackie has her first ultrasound, the family gets even more unbelievable news.
And they said, "Congratulations, you're having twins."
Not only 1, but 2 of the embryos have successfully implanted.
Okay, so I know from a patient standpoint that is super exciting. I have been there personally, pregnant with twins. It's also scary to me watching this as an OB because now I know her pregnancy risks just skyrocketed. So she has a much higher risk pregnancy just because of her age. And then in addition to that, basically every risk that is increased with age also increases with the number of fetuses on the inside of the uterus. More and more multiples, more and more risk, more and more years of life, more and more risk.
9 weeks into the pregnancy, Jackie starts bleeding.
Oh, I'm losing these babies.
They determine that the stretching of Jackie's 55-year-old uterus is the cause of her bleeding.
Adding a layer upon layer of how concerned I am about her health and the health of the babies during this pregnancy.
There's the one, there's the heartbeat, there's the second one, there's the heartbeat. Wait a minute. And he looked over at me and he's like, "Triplets? You're having 3 babies." And I'm like, "Mom!"
Okay, 1 second. So her reaction is awesome, and I can't think about that because it gives me anxiety as a mother who's had multiples. Having another one in there would just be even more terrifying, and as an OB, that again adds on the layers. But in that clip just now that they showed, and it said 1, 2, and then it zoomed in on something else, that was the probe. 1 baby, that's a gestational sac with a fetal pole inside that's marked A. They have another baby, a gestational sac with a fetal pole inside that's marked B, and then the kind of rounded portion at the top is where the transvaginal ultrasound probe is. They just zoomed in on saying this is the 3rd baby is an ultrasound probe. I guess it works for the effect, but it's not correct.
3 babies, there's 3 babies in there. She's like, "No, there's not." I'm like, "Yeah, there is."
One of the 2 implanted embryos has split. Jackie is now carrying 2 more babies than anyone expected at the beginning.
My mom's like, "Kim, I'm gonna kill you."
Okay, that's interesting too. So it's not the 3 that they transferred that have become the fetuses. It's 2 that they transferred were implanted, and now one of those has split. So they had 2 embryos, and those would be fraternal or dizygotic twins. And then one of those embryos split into identical or monozygotic twins. So she's essentially carrying a set of identical twins with a non-identical triplet. Interesting.
Really something that could have risks for her.
But there's also a problem with 2 of the babies, who are identical twins.
One could take all the nutrients and not give the other any nutrients at all and not continue to develop, which would jeopardize the entire pregnancy. And at that point, we may lose all of them.
We talked to them about the potential of doing what's called selective reduction, where you can actually abort one pregnancy or even 2.
My mom looked at me and she said, absolutely not. I don't care if it kills me. I'm having these babies.
Let's talk about this a second, because I like that they touched on it, but I dislike that they skirted over this, editing in basically the grandmother saying, I would carry these babies even if it killed me. It's not purely for the health of the person carrying the pregnancy. What she was mentioning about one taking all the nutrients is twin-twin transfusion syndrome that can happen in monochorionic diamniotic twins, which is twins that share a placenta. When one baby in a situation like that passes away from something like twin-twin transfusion syndrome, it often causes the other babies to have significant compromise and often leads to death in both babies. There's a not low chance that this could end up with all 3 of the babies compromised. They're talking about this because it puts everybody at risk, not just the person carrying the babies. Selective reduction is not something that anybody ever wants to be in a situation where they have to talk about. If somebody has gone through infertility treatment and gotten pregnant with higher order multiples, they want all of those babies to be there safely. I just think it's really important to know nobody wants to be in that situation. It's not an easy decision, and it's so much more nuanced than just how quickly they skirted over it here. And if you fall into a category that feels like you would never make that decision, that's great, but you don't get to have an opinion about that for other people who are walking through the most difficult decision that they've had to make to this point in their life. Nobody wants to make that decision, and your opinion on it, if you've never been in that situation or cared for someone who is in that situation, is really relatively meaningless. So keep it to yourself. Don't make that harder on somebody who's walking through one of the most difficult decisions they will ever make.
The 33-week mark, when Jackie goes in for her next prenatal visit.
And I'm like, this isn't normal.
The risk for the babies included what's called twin-to-twin transfusion syndrome. Being identical twins, there can often be reversal of blood flow across the placentas. One baby would be considered a donor and the other one a recipient.
It's a highly dangerous situation.
Dr. Kiwi wanted us to go home, pack our bags, get to the hospital right away. No matter what, we're delivering first thing in the morning.
As far as twin-twin transfusion syndrome goes, if you're going to have it, 33 weeks with triplets is a pretty good time for that to happen. It often happens way earlier, 17 or 18 weeks, and at that point is much more threatening. It's not usually an acute issue, meaning it doesn't usually happen and then something goes wrong tomorrow. So they probably have been having them come in for regular ultrasounds every couple of weeks, looking at the fluid around the babies, looking at the size of the babies, looking at all of the structures and things like that. And what they probably recognize at this ultrasound is that there was either a big discordance in the fluid amounts between the identical twins. One had a lot of fluid and one had very little fluid, or there was a big discrepancy in their weights. At 33 weeks, honestly, I mean, what more can you ask for? That's a very good gestational age for triplets on its own. For triplets that include a set of monozygotic twins, that's even more amazing. And then for triplets that include a set of monozygotic twins in a patient who is 55 years old, that's amazing. So, you know, nobody wants to have preterm babies, but as far as high risk, unusual, higher order multiple pregnancies go, I mean, this is great.
Early the next morning, Jackie is wheeled into the OR for an emergency C-section.
Another semantics thing. This is not an emergency C-section. There's all these distinctions of C-section, but emergency C-section is where you come in not planning to have a baby or not planning to have a baby by C-section and something changes like that. Decision to incision, meaning from the time we decide we need to do a C-section till the time that we make the incision on the abdomen should be 30 minutes or less. And in some cases, it's way faster than that. If you have time to leave and go home and gather your things and come back, it's not an emergency. It may be something that needs to happen sooner rather than later, but it's not an emergency. The reason I make this distinction is because it's something I hear a lot, and it's something that should not be thrown around so easily. My first son, my second pregnancy, my third baby, that was the most confusing way to talk about my kids ever, but he was an emergency C-section. We went from in the room, in labor, doing fine, to baby delivered surgically in 8 minutes. That's emergent. Urgent is like an hour to 2 hours, and this is not an emergency. That was like 5 minutes of me explaining why that one word annoyed me, so.
You know, they're still 10 weeks early.
Elizabeth is the first baby out.
And she looked really good. She looked really healthy.
Next, the identical twins. First, Carmina, the one who has stopped growing. She's the baby in the most peril.
She didn't look good at all. She was like a grayish color, the tiniest baby I've ever seen in my entire life. She was 2 pounds, and instantly they just whisked her away, and it appeared that she wasn't breathing.
2 pounds is really tiny for 33 weeks. I think they said 33 weeks is where we're at, so that is really tiny.
Gabriella, the other identical twin, is the last to be delivered.
And she looked better than Carmina, but still not as great as Elizabeth, but I could tell that she was okay.
All the babies are rushed to the neonatal intensive care unit.
She told us that they had a honeymoon period where they would do great, but that at a certain point, expect setbacks. It happens with all NICU babies. We didn't have any.
But Jackie does. After being released from the hospital, her internal stitches began leaking.
All of a sudden, her life was in danger. When the surgeon saw her, it was immediate. He said, "You're going straight for surgery. I have to clear the rest of my day. I have to operate now because in the morning, if we don't get this taken care of, you could be dead. You are very sick."
Jackie is touch and go for a while, but the emergency surgery corrects the problem.
Not understanding from what they're saying what was happening, the internal stitches leaking 2 weeks after delivery would be very weird and not something, I don't know what they're talking about. So it sounds like she had some kind of secondary hemorrhage, postpartum hemorrhage that happened well after delivery, but it shouldn't be just internal stitches leaking. That's weird. I don't know. The babies will probably spend about 7 weeks in the NICU, sometimes a little less, sometimes a little more. Generally, we expect them to be in the ICU until close to their due date. And again, some babies do great and get out earlier, and some babies need to stay longer.
To everyone's relief, after nearly 2 months in the NICU, the triplets are all doing well enough that they are cleared to go home.
Thanks, Grandma.
They are just a barrel of laughs all the time. They are some characters. They're just amazing.
And Jackie's now famous, not only for giving birth to her own grandchildren, but also because she's believed to be the oldest woman in the U.S. to deliver triplets.
To me, it was just another thing I did to make my daughter happy.
You're supposed to go home.
I absolutely can never repay her. She gave us 3 of the most beautiful things in the world.
They seem to be closing in on the end of this, and they still haven't told me how much each of the babies weigh. I want to know what the size discrepancy was between the identical twins, because I would like to know how compromised they were, and I also want to know how big the non-identical twin was to get an idea of where we were. But yeah, that's just my medical brain asking for medical information from this medical documentary.
She truly gave us the ultimate gift of life.
Okay, I guess we're not getting that. Sorry, guys, too bad. If you want to know how much the babies weigh, that's too bad for you. We don't get to know. We also don't get to know what actually ended up happening to the grandmother because they didn't tell us. And they didn't tell us what surgery they had to do or anything else. So, I got nothing. That's all I got. Thank you for watching. If you like this video and you're still here, so I'm assuming you liked it, give it a thumbs up. If you're not subscribed, hit that subscribe button. Be kind to yourself, to each other, to me, In the comments, be kind, and I will see you next time.